Good morning, good afternoon, or good evening, everyone, and welcome to this webinar. I am sharing my screen to start us off. Let me introduce myself. My name is Caroline Moreau. I am a professor at the Bloomberg School of Public Health at Hopkins, and it's really my great pleasure to invite you today to a session where we're going to share some key findings from a special edition of the Journal of Adolescent Health that was published in December, I believe, entitled "The Rise in Adolescent Social and Health Inequities Amidst the COVID Pandemic." So much of this work draws on the Global Early Adolescent Study, which is one of the largest longitudinal studies that explores gender and health among adolescents that are living in impoverished communities around the world. It also draws on a sister study that was conducted in Kenya that explores some of these topics among older adolescents that are 15 to 20 years of age. So I will provide a brief introduction and then invite my four colleagues and friends to present some various aspects of young people's experiences, challenges, as well as coping strategies that are related to the pandemic. First, I will call on Mengmeng Li, who's a senior data analyst for the Global Early Adolescent Study at Johns Hopkins University. And she will share her findings of a study that is looking at trends over time and young people's anxiety over the course of the pandemic, and specifically in two sites in Shanghai and Kinshasa that had several time points before and after the pandemic to be able to explore those trends. Next, I will call on Eva Muluve, who is a senior researcher at the Top Council in Nairobi, Kenya. And she will talk about the sister study that was conducted in Nairobi and Kisumu in Kenya about the experiences of young people who became pregnant or young mothers during the pandemic and the specific vulnerabilities in this population. Next, we will pivot to Chunyan Yu, who's an associate researcher at the Shanghai Institute for Biomedical and Pharmaceutical Technologies, who's part of the Global Early Adolescent Study in Shanghai. And she will share some perspective on the ways the pandemic has exacerbated food insufficiencies in young people living in Asia and Africa. And finally, but not least, I will call on Kristin Mmari, associate professor at the School of Public Health at Hopkins. She's co-PI of the Global Early Adolescent Study. She will provide us hope and end this conversation on a more positive perspective on young people's coping strategies related to pandemic stressors. So before I leave the baton to Momo, just a few words about the Global Early Adolescent Study. It's a global research initiative that explores gender norms and how it alters young people's health trajectories from early adolescence to adolescent years, older adolescent years. And an opportunity to actually use this research infrastructure that was implemented in many sites around the world, you see it on the map, to particularly interrogate the consequences of a global crisis, a global sanitary crisis on the lives of young people, and specifically young people living in urban poor communities. So this COVID sub-study's objectives were to investigate how young people experience social distancing and educational disruptions, the impact of the pandemic on young people's health and well-being, and what types of support they needed to cope with the pandemic and its aftermath. So to do that, we pulled together a team of people across the global early adolescent study sites to conduct a mixed method study that involved more than 2,800 young people across the globe. To question this using both quantitative and qualitative data, and you will hear from their perspectives throughout these presentations. So with no further ado, I will pass the baton to Momo, who will talk about young people's experience and anxiety during the pandemic. And I will stop sharing my screen now.
Thank you, Caroline. I'm in the process of sharing my screen, and I hope this has become visible in front of all of you. Okay, so let's start. So first off, thank you for spending time with us today. And I'm gonna briefly sharing the results for one of the COVID supplement research project that's focusing on assessing the trajectory of anxiety among adolescents during the pandemic, draw the evidence from Shanghai, China, and the Kinshasa, DRC. So as we all clear about, the COVID pandemic has caused widespread disruptions globally, both due to the rapid viral transmission and its associated control practices. And in the same time window, mental health conditions such as depression and anxiety increased rapidly among young people from different geographic regions during the pandemic. And evidence primarily from China and the European countries highlighted the elevated mental health stress among children and adolescents. However, these widespread consequences of pandemic on human society were not equally distributed across all populations. The existing social hierarchies that are imposed by gender, race and ethnicity, and social economic status could have been exacerbated health disparities or inequalities. Therefore, social economic disadvantages, especially in the context of global health emergency, may have compounded the negative aspect on mental health among adolescents from low resource settings. However, very few studies or most studies only focus on adolescent populations from the Western context, which limits our understanding of mental health impacts in the global setting. And also, most studies have employed cross-sectional designs or just the simple pre-post comparisons to understand mental health condition during the pandemic. And this approach could also hinder a deeper understanding of how mental health outcome evolves over time in relation to the whole duration of the pandemic. And lastly, the investigations have largely centered on identifying the risk and protective factors associated with mental health outcome. So there's a need calling for more research on understanding how COVID pandemic-related adversities impact mental health among the adolescents. So our research questions aimed to evaluate the anxiety trajectory among disadvantaged adolescents from Shanghai, China, and the Kinshasa, DRC during multiple time points in the pandemic compared to the pre-pandemic region. And also, we dive further, performed effect modification analysis to understand how pandemic-related adversity modify this trajectory in both study sites. So for both sites, we choose the Wave 2 GES main survey as the pre-pandemic time point, or T1 for brief, because the data collection process concluded in the December 2018 or very early January 2019 in both locations. And also for both study sites, we implemented 2 rounds of the COVID interview, with the first round of the interview occurred roughly 6 months after the pandemic emergence in the respective location. And the second round of the interview represents roughly 1 year into the pandemic in the locations. And we analyzed over 500 adolescents in Shanghai and over 300 adolescents from Kinshasa. and we implemented or utilized a valid instrument to quantify the symptoms of anxiety. And for this analysis, we focus on moderate to severe level of the symptoms of anxiety. And in the GES COVID interview, we cover or collect data on a wide range of COVID-related adversities, including the concerns about infection, family financial constraints, food insecurity, concern about education completion, and negative household experiences. And we applied appropriate statistical modeling to analyze the trend. And we further pursued effect modification analysis to investigate if the trend were influenced by those adversities. So at the first round of the COVID interview, which is roughly 6 months into the pandemic, adolescents from both sides were roughly 15 years old, and both boys and girls nearly equally represented in the study analytical population. And about 90% of adolescents from Shanghai and roughly 60% from Kinshasa reporting they were living with both parents. And on the flip side, almost all adolescents from Kinshasa and only 25% of adolescents in Shanghai reporting they have siblings at home. And we can tell from the table number here, roughly a significant proportion of adolescents from both sides reporting they have ever had 3 or more adverse childhood experiences before the pandemic start. And they all have a moderate level of depressive symptoms before the pandemic. And for this graph, we can show here, if we focus on the 6 months into the pandemic, this time point, and compare to the pre-pandemic time point, we saw almost a nearly 10% increasing in the prevalence of moderate to severe anxiety among female adolescents in Shanghai. And this increasing in the anxiety actually translates to roughly 120% increase in the odds of anxiety at 6 months of the pandemic, after we adjusting for factors listed on this slides. And this increasing trend did not sustain at 1 year into the pandemic. And among the boys in Shanghai and also both boys and girls from Kinshasa, we didn't notice statistically increasing in the level of anxiety. Next, we pursued further analysis to understand how pandemic-related adversity experience impact those trends. At this slide, we focus on the first time point into the pandemic. And we didn't observe significantly alteration relationship of the adversity on those anxiety trend for adolescents from both sides. And we applied the similar approach, but this time we focused on the 1 year into the pandemic, the second time point. And we noticed that negative household experience actually modified the anxiety level only among adolescent girls in Shanghai, where girls reporting have no or very few negative household experiences had reduced the anxiety level by almost the 75%, which is a significant magnitude. However, this decreasing trend in anxiety was not observed if a girl reporting they have had negative household experience. And the anxiety trend at this the second time point compared to the pre-pandemic time point was not for adolescent boys in Shanghai and all adolescents from Kinshasa was not impacted by COVID-related adversities. To conclude, this study is a first longitudinal evaluation of adolescent mental health before and also during multiple time points into the pandemic. So it assesses both short-term and long-term pandemic effect among adolescents from 2 culturally diverse low-resource settings. And we observed female adolescents in Shanghai experienced the increased anxiety level or symptoms during the early phase of the pandemic. And this increase actually resolved within the first year of the pandemic. And for boys in Shanghai and both boys and girls from Kinshasa, we didn't notice similar elevated anxiety levels. In general, COVID-19 pandemic-related adversities did not modify anxiety trajectory in either setting. However, roughly 1 year into pandemic, we noticed that adolescent girls in Shanghai report the decreased anxiety if they experienced very few or didn't experience negative household events. However, this decrease was not observed among adolescents who have negative household events. The interpretation of these findings, we should consider the relative sample size, especially for Kinshasa analysis, and this could limit the statistical power to detect the significant effect modification effect by the pandemic-related adversities. Overall, our findings underscore the need for the development and implementation of the program that targeted at buffering public health emergency-induced adversities among adolescents, especially from the marginalized backgrounds during the future public health crisis. Thank you. This is the main findings from this project. Now I'll give the floor to Eva to share her findings. Thank you.
Thank you, Momo. Yes. So I'll be sharing about like one of the sister studies that was looking at some of the impacts the pandemic was having on adolescents and young women. So basically, the study was done in Kenya, and it was a mixed method studies. In terms of background, the COVID-19 pandemic, of course, through literature, through what we saw and the reports we were getting, we saw that it did have quite unprecedented economic and health impacts, especially in low resource settings, and vulnerable groups such as children, pregnant and parenting women were faced with quite a number of challenges, including reduced access to food, reduced access to reproductive health services, which led to increased social and health inequities during the COVID pandemic time. In Kenya, especially during the onset of the pandemic or the early months of the pandemic, there was a lot of like reports that were signaling a growing evidence of rising adolescent pregnancy rates as a result of the pandemic conditions. And there was evidence already coming up looking at or showing that pregnant and parenting adolescents, especially in the developed context, were experiencing heightened psychosocial and economic challenges. And also, we saw that evidence from previous pandemics, such as the Ebola epidemics, for example, indicating that pregnant and parenting adolescents actually face high vulnerabilities in such contexts. And also, we did see from literature that several studies conducted during the COVID pandemic time indicated limited access to maternal and child care services, especially for women, and that also the conditions faced during that pandemic time had led to heightened mental health challenges for pregnant and parenting young women in several contexts of the world. However, very limited studies were looking at the experiences of pregnant and parenting mothers in sub-Saharan Africa. And therefore, that's what we sought to explore based on a secondary analysis, just to examine what data was indicating regarding experiences of pregnant and parenting adolescents and young women during those first 2 years of the coronavirus pandemic. So we sought to examine how a range of health outcomes and behaviors, such as maternal health, access to health services, and food insecurity differed according to the experience of a recent pregnancy, and especially during those first years of the pandemic. And the study was conducted in Kenya, particularly in 3 settings, that is Nairobi, Kilifi, and Kisumu counties. So in terms of methodologies, the study in itself was an explanatory sequential mixed method study that leveraged on data that was being collected from the Population Council, and they had implemented studies on knowledge, attitudes, and practices among young adolescents and women, that is 15 to 22-year-olds in these 3 settings. So we are just going to explore the learnings that were coming out of both the quantitative data that was collected in 3 time points, in June to August of 2020, February to March of 2021, and February to March of 2022, and qualitative evidence of the same cohort of young people aged 15 to 22 years that was collected in November of 2020 and April of 2022. So here is what we learned. In terms of like the demographics, the total number of adolescents and young people interviewed in 2020 were about 2,337, 1,438 of them interviewed in 2021, and 1,669 interviewed. And out of those, we did see the rates of pregnancy being around 6% of all those interviewed in 2020, around 5% by 2021. And the average ages of this cohort in 2020 was about 18.3. In 2021, they were a bit older at around average age of 18.6. And by 2022, they were about 19 years old. And for the qualitative sample, we ended up interviewing about 59 participants in 2020 and 28 participants in 2022, with some of them being pregnant, some of them being recent moms, and some of them not being pregnant. So for this particular analysis, the quantitative evidence was analyzed cross-sectionally. And this is because most of the pregnant adolescents were not the same across the 3 time points. So in terms of the results, we do see a great, in terms of depressive symptoms, we did see like quite some interesting findings. We saw that among those recently pregnant and parenting, the depressive symptoms decreased from 2020, sorry, at 21%. To about 6% in 2022, with similar trends of depressive symptoms being experienced among both the pregnant and recently parenting adolescents and those that had not been pregnant or parenting. However, when we looked at the qualitative evidence, we did see like quite some rich nuances around like the unique challenges that the pregnant and parenting adolescents were facing, especially around those 2 years in 2020 and 2022, as most of these adolescents who had been pregnant or had recently had a baby described like feeling a lot of anxiety, tension, worry, a lot of like the poor mental health among them being exacerbated because of the disruptions in routines during the time of COVID, a lot of like pregnant related stigma, loss of social support because then there was minimal interaction, as well as them reporting relationship breakdowns, especially between 2020 and 2022, when they had like a good relationships with their partners during the COVID breaks, or when there was closures due to the pandemic. But after like schools reopened by 2022, then issues around like broken relationships were reported, especially among this cohort of girls. There was also issues around financial deprivation being linked to worsening issues around like mental health, and especially the adolescents in urban informal settlements, struggling to meet like their basic needs for themselves and their babies. And this then led to increased stress levels. We also saw issues around job losses and the lack of resources that were further exacerbated by economic challenges also being a big contributor of mental health challenges among the pregnant and parenting adolescents, but generally among all adolescents as well. So as we can see, those are some of the qualitative quotes that were coming up from the data. For example, we see one girl from one of the regions in Kilifi in 22 saying that when she got pregnant, they stayed for like 2 months and then separated. And when schools were closed, they were in good terms with the boyfriend. But when the schools reopened and the boyfriend went back to school, then when that boyfriend came back for half term, he requested like they break up. So those are like some of the nuances we were seeing in the data as the challenges that led to a lot of mental health or depressive symptoms among adolescents and young women who are pregnant or recently parenting. In terms of like skipping health services, we did see a great proportion of pregnant and parenting respondent reporting skipping health services. In 2021, about 28% of them reported having skipped health services. And then we see a decline over time. By 2022, only 16% of them reported that they had skipped health services. And then we also saw that recently pregnant and parenting adolescents reported over twice the odds of skipping health services when compared to those who are not recently pregnant or parenting, and also had about 1.8 higher odds of skipping health services in 2021. And we see that in 2022, that the magnitude of the effect was not significant. Qualitatively, we also saw a lot of sentiments around their experiences, them reporting that they had difficulty accessing health facilities, and this was mainly because of the closures of the facilities, hence resulting in missed appointments, as well as the issue around economics, partial loss or complete income loss, contributing to their inability to afford healthcare services. We also looked at food security. So when we looked at skipping meal, we saw that for those who had recently been pregnant or parenting, over half reported skipping meals a couple of times a week in 2020, with the percentage dropping to 31% by 2022. And then the recently pregnant and parenting were also associated with skipping meals during 2022. With the recent pregnancy or parenting adolescents reporting about 90% higher odds of skipping meals. However, these associations were not significant in 2020 and 2021. However, qualitatively, we did see quite some rich data indicating that the pregnant and parenting adolescents really faced struggles when it came to food. They struggled to find casual jobs, for example, to be able to fend for the needs for their babies, including food. There was disruptions of food supply chains, and therefore they did get as well difficulties around accessing nutritious foods for themselves and as well as for their children. And this then led to varied and less nutritious diets and concerns about their baby's health. And those are just some of the qualitative quotes. For example, we see one adolescent from Kisumu indicating that they just had to give their baby porridge because they did not have any other alternative food. So in conclusion, the study did indicate that there were several challenges that the pregnant and parenting adolescents faced, including the mental health issues, food insecurity issues, and issues related to access of healthcare. And we also see that the conditions within the pandemic increased the pre-existing challenges that are associated with adolescents and young people's health. And this predisposed the young and parenting, pregnant and parenting women to greater adversity than their non-pregnant or parenting counterparts. And therefore, in terms of policy implications, in terms of what to think through in this kind of context, then we're proposing for targeted and responsive approaches during emergencies, during crisis, such as social protection, food security, and mental health response programs for this kind of vulnerable populations, and as well as integrating these kinds of approaches into disaster response plans. So thank you very much. That's the end of my presentation, and I'll hand over to Chunyan.
Okay, good morning, good evening. And I'm gonna share my screen. Okay, just wait for a moment. Okay. This is Chunyan Yu from Shanghai Institute for Biomedical and Pharmaceutical Technologies. I'm gonna share with you an interesting theme about the food insufficiency and what COVID-19 have the impact on food insufficiency. Thank you for our co-authors who have contributed a lot to this work. COVID-19 pandemic has led to a high food insufficiency rate worldwide, but if this exacerbates disparities among people from various social demographic groups is unknown, and adolescents are especially vulnerable to food hardship. For example, the food insecurity and food insufficiency would have the negative impacts on physical health, nutritional well-being, as well as the emotional well-being. But food insufficiency is highly prevalent but understudied among urban poor young adolescents. So Global Early Adolescence and the Added on COVID-19 module provided our data for this better understanding of the food insufficiency and the role that COVID-19 outbreak played. So our study aim, one, is to explore the effect of COVID-19 and the variations in social demographic determinants on food insufficiency. Our aim, two, was to identify the role of COVID-19 induced economic and community factors on adolescent food insufficiency. So the respondents, the participants are those respondents who completed a COVID-19 module as part of longitudinal GA study in 5 low and middle income study sites. Our measurement includes the dependent variable is the food insufficiency, which asked about whether the family had enough food or money to buy enough food. And the independent variable for the aim one is the COVID-19 indicator we as Mengmeng just described, that we have the pre-COVID data and amid COVID data. So we separate this into 2 times and then generated this indicator. And the COVID-19 for the aim2, our independent variables are the COVID-19 induced economic and community factors that's collected in the COVID-19 module. The covariants are age, sex, family wealth index, main caregiver, and neighborhood safety perceptions collected in the GEA's main study. We used the logistic regression to analyze the longitudinal data with the consideration with the missing data and also the attrition of loss of follow-up. So this slide shows the result of the food insufficiency rate before COVID-19 outbreak and during the first round of the COVID-19 data collection. So the rate of food insufficiency before COVID-19 ranged from about 2% in Shanghai to about 50% in Blantyre, while the point estimate of the post-month food insufficiency rate during the first round of COVID-19 is ranged from about 9% in Shanghai to 79% in Blantyre. And this slide shows the effect of COVID-19 outbreak on food insufficiency. The first figure shows the increased percentages of food insufficiency rate, increase the percentage of food insufficiency rate across 5 sites. And here, contrast shows the highest increase in food insufficiency. Shanghai and Samara have the lowest reported increases, while the rising food insufficiency were more pronounced in Denpasar than in Samara, as both Denpasar and Samara are from Indonesia. So the second figure showed that the adjusted OR of food insufficiency compared to baseline, accounting for the social demographic factors. Shanghai and Blantyre here showed a significant impact of COVID-19 outbreak on food insufficiency with the highest adjusted ORs, but the confidence interval is very large for Shanghai. And this slide shows that the odds ratio of the COVID-19 indicator, as well as the covariance and their possible interactions with the COVID-19 indicators. So this actually reveals if the COVID-19 widened the disparities across social demographic factors. And we could see that in Blantyre, the effect of COVID-19 was modified by family wealth index, sex, main caregiver, and the perceived neighborhood safety. To be specific, boys and those living in families within the middle wealth tertile experienced the most pronounced disparities, while having mother as main caregiver and perceived neighborhood safety provides the attenuated effect of COVID-19 on food insufficiency. Also, in two sides of Indonesia, we could see that boys had higher odds of food insufficiency than girls during the COVID-19. And in three sides of Asia, neighborhood safety was a protective factor for food insufficiency. And this slide shows the association between COVID-19-induced economic and community factors and food insufficiency during the pandemic. We could see from the result that difficulty in affording things was consistently associated with food insufficiency, which might indicate that experiencing financial constraints directly affects their ability to purchase food. And also in three Asian sites, anger towards distancing rules were associated with higher food insufficiency. This echoes other studies that showing emotions were correlated contemporaneously with food insufficiency. And interestingly, higher community harmony was associated with a reduced risk of food insufficiency in Shanghai, but associated with an increased risk in Blantyre. Generally, we believe that bonding among community members could potentially improve food sharing and security. But if the sources are limited, this could be complicated, and community connectedness may mirror overall hardship, which could be detrimental to this group of adolescents. So, to draw in light of our study results, it's imperative for the policymakers and stakeholders to meet the adolescents' needs in urban poor settings, especially under the ongoing challenge of the COVID-19 and other infectious disease crisis. There are also need for tailored programs and policies for comprehensive strategies to tackle the economic disparities, as well as to emphasize the community environment. We propose that through monitoring of food insufficiency and strengthening the social safety nets, it could mitigate the effect of the pandemic and bolster the resilience in future crises. Thank you for listening. So I'll give my mic to Kristin.
Thank you so much. I'm going to try to attempt to share my screen, so bear with me. It's almost up. Okay, here we go. Everyone see this okay? Okay, great. So I'm going to, again, attempt to put a little bit of a positive lens to this work, as Caroline alluded to at the beginning, by talking about how adolescents coped with these stressors during the pandemic, and how did these coping strategies vary across our sites. So I'd like to first acknowledge my co-authors here. And then let's start out with just talking about why we should care about coping. So we all know that adolescence is a very difficult stage. There's lots of changes going on, and they're facing a number of different stressors. So understanding how adolescents cope with these stressors is really essential to helping us understand best how to equip them with the things that they need to progress in their development and their mental health. So the concept of coping is really twofold. It involves both actions and cognitive efforts. So on one hand, coping involves behaviors that adolescents can implement to mitigate their stressors. But then on the other hand, it involves mental strategies that they can use to also lessen some of these stressors that they're facing and the sources of stress. So there's lots of different types of coping that they can use. So I'm just going to go through some of the more dominant ones. So problem focused, as the name suggests, involves those actions that are directly targeting the source of stress in an effort to try to remove it or mitigate it. So if an adolescent is really stressed about a test, they can use problem solving to study as a way to kind of mitigate that. Emotion focused is, like the name suggests, really focuses on those emotional responses of stress. So if an adolescent is feeling sad, they may want to watch comedy. Many adolescents, for example, talked about listening to music. So those are the types of coping strategy skills. Social support, or the notion of seeking social support from friends and family, has been found to be very effective. I know a lot of us use that when we have problems, and that's been found to really mitigate and manage the types of emotional and behavioral responses towards stress. Religious coping, as the name also suggests, can involve cognitive, emotional, or behavioral responses to stress that have a religious basis. So prayer is very common, or going to church may really help. And then finally, the last type of coping strategy is what we call cognitive reframing, and that's really a psychological technique of identifying what the stress is and then reframing it in one's mind to try to remove that feeling of stress. So now that we know the importance of coping and the different types of coping strategies, I've looked at some of this research, and there's been quite a lot of research that have focused on these different coping strategies, and have shown that the type of coping strategies that adolescents implement really does influence their mental health and their well-being. But culture is an essential influencer of all of this. And especially among adults, they've shown that culture, the norms, the values that are within a given society can dictate what the perceived stress even is, and then what the chosen coping strategy is going to be used to alleviate that source of stress. But this has mainly been done among adults, and very little is known among adolescents. So to alleviate this gap, this study was really meant to look at these patterns of stressors associated specifically with the COVID pandemic among adolescents across these different cultural settings, and then to look at how these coping strategies then varied also across sites that were used to alleviate the stressors, again, specifically related to COVID. So you saw this table at the beginning, Caroline presented, but I just wanted to note that this paper was really only focused on focus group data. And just to emphasize that 9 sites were used, and they varied according to how the focus group was done, whether it was done virtually or in person, the number of participants that were included, and also the timing. In general, the range was a year. So September 2020 was the earliest that the focus groups were conducted, and the latest was September of 2021. So in terms of the analysis, all the transcripts then were translated into English across the sites, checked for quality, and then they were uploaded into Atlas TI. We used an inductive thematic approach to analyze the transcripts, to look for the themes across the sites, and especially to notice whether there were any similarities and differences, particularly between boys and girls, as well as culture. Coding was completed by 2 different researchers, and that was used to generate an initial set of codes, and then these codes were then shared with the sites for feedback to then finalize the coding codebook. Then the matrices of these key codes were then developed by site and by gender to notice whether there were patterns within a site, and then also whether there were differences by gender. So what did we find? So this is a slide just to show you kind of what the top concerns were among adolescents across the sites. And to point out a few things, you can see that the most common reported stressor was online schooling, especially during the lockdown. And this was reported among adolescents across sites with the exception of Blantyre and Kinshasa. And then this was followed by losing friendships, also very much related to the lockdown, not being able to see their friends. In a few sites, though, they were talking about a negative peer influence, so some of their friends were causing them more stress, actually. Then there were some unique stressors by site. So you can see here in Shanghai, adolescents reported this fear of food safety. that they thought that the food at the grocery stores were not safe to eat. Several adolescents also were fearful of gaining weight during the pandemic. They weren't going out as much and moving. And then likewise in Kinshasa and Blantyre, there were unique types of stressors. And this was really related to economic constraints, a lot like what you just heard. So not having enough food and not meeting their basic needs. And then they also were very fearful of actually dying from illness because they didn't feel they had the protections necessary in place to protect them. So I want to just then share a little bit about how adolescents discuss these types of concerns. And even within a particular stressor, it varied by site in terms of how it was discussed. So for example, online schooling, as I said, was a very common stressor, but it varied in terms of how it was discussed in sites. So as an example, in Shanghai, adolescents were very scared about their academic decline. So this is a boy that talks about this. The most worrying thing during this epidemic period is that we still have to take the high school entrance examination. I'm worried about this and nothing else. In Semarang, however, it was more related to accessing the internet. So here a boy says, well, the challenge is the same, wasting more internet credits to take the online classes, and sometimes the connection is unsteady. In Denpasar, this is again, another predominant stressor was losing friendships, and again, mainly related to the pandemic. So this is an example of a girl discussing this. And I miss the school environment with my friends. I miss hanging out with them, but now I can't hang out with them anymore. It's been rare. I've only met them twice now. And then like we've been talking about across many of these presentations so far is this notion of not having enough food. And so this was very evident in Kinshasa and Blantyre, but this is an example of a girl talking about this. It was difficult to eat. We didn't have any provisions and no possibility of paying rent. It was difficult to get food supplies, and plus there was monetary inflation, so food was more expensive. So then, how did this, if I can, there we go. How did this correlate to their coping strategies then? So just to point out, the most common coping strategy that was utilized across every site was social support. And this did vary by gender. So girls were typically more likely to report seeking out social support from their parents and most likely their mother. Whereas in other sites, boys were more likely to seek out social support from their friends. And this was followed by then emotion focused. And we heard lots of different ways that this was used from, like I said, listening to music. Some people journaled. Many like to watch funny things online to try to alleviate their sadness and worry. And then followed by problem focused. Only religious coping mechanisms were seen in Kinshasa and Blantyre. And then similarly, cognitive reframing was only seen among adolescents in Ghent and Shanghai. So to see a little bit about how these coping mechanisms were discussed. These are just a few examples just to give you an idea. But in Shanghai, again, remember the primary stressor in Shanghai was really this fear of academic decline. So to deal with that, many adolescents used problem-focused. And here's an example of a boy who tried to put pressure on himself to do better in his academic studies. So he says, I set up pressure for myself. If I don't achieve the goal I set sometimes, I transfer 100 won to my parents by WeChat. On another type of coping mechanism, emotion focused, here's an example of a girl in Santiago talking about this. So she says, when I'm sad, what I like to do is just listen to music that represents me at the moment. There's this saying that when you're sad, you should just listen to joyful music to make you happy. But I listen to sad music because when I cry, I feel like I can let out everything I have and the problems go away. Religious, as I said, was only mentioned by Blantyre and Kinshasa, and this is just an example from a girl in Blantyre. When I have worries, I just kneel down and talk to God because he's the greatest physician in the world. And then finally, like I said, social support was used across every single site. But as I said before, boys were mostly likely to talk to their friends, and this is an example of this. When I have worries, I go to my friend for help. If I cannot solve my worries, I need to share them with a friend so that the burden may be lifted. So to put this all together, we see that these coping strategies largely align with their patterns of perceived stressors, But again, these were largely also influenced by the socioeconomic influences. So particularly adolescents in Blantyre and Kinshasa reported these stressors related to food, meeting their basic needs. So cognitive reframing in this case is not going to be very useful because this need is much more immediate. So problem-focused social support were much more useful. Adolescents in other sites then reported stressors mainly related to the school lockdown. And this then, really dictated the types of coping strategies, which were commonly problem solving or emotion focused, as well as social support. Interesting in Shanghai, though, with this primary concern about academic decline, adolescents were more likely to use problem-focused and cognitive reframing to ensure that they were not going to decline even further. And this cognitive reframing was really interesting because that may be related more to the cultural norms. In one study I read about China as a whole, adolescents and people in general typically like to think about things as opposing factors, so bad and good. And so it may be that this cognitive reframing was very useful. So if they felt like they were failing, it was going to be okay because that would actually help them be successful later on. So those opposing factors coming into play there. But regardless of culture, regardless of gender, of socioeconomic status, we saw that social support was indeed the most predominant. So to put these all together and to move forward, and to really help bolster adolescents' coping strategies among adolescents, we first have to find out who has the resources and what are their concerns, because that does dictate the types of tools that they need and the type of help that can be best used to help them thrive in these kinds of crisis situations. So I think I will end there. And before we go into discussion and questions, I do want to thank our funders for this study, and that was the Oak Foundation and AstraZeneca, the Young Health Program, for providing us with the funds and the support. So thank you all very, very much. And I'm going to stop sharing my screen.
Thank you, Kristin. Thank you to all our panelists. I think across the studies, we observe the pandemic has had significant effects on hardships, their economic, their social on young people, and they adversely affect their health, both behaviors and outcomes. We also find that these effects seem to be exacerbated among the most vulnerable in some communities, although it seems to vary across sites. And some of these effects are short-lived versus longer effects. So we have one question in the chat, and I encourage you to use the Q&A to pose all of your questions, but I will take William Stone's first question, and this is for Eva. In the Kenya context, it might not have been in the scope of the study, but was there any indication from the qualitative interviews of more unintended pregnancies during COVID?
Thank you. Thank you, William, for the good question. So we didn't have that evidence to clearly indicate whether the pregnancies were intended or unintended, because the full focus of the secondary analysis was just to derive what their experiences was. But it was not, it's not something that came up from the evidence as far as I know.
Thank you, Eva. And so one follow-up question, Eva, is you had 3 sites, and somebody in the chat raised a really important question that Kristin has also alluded to, is kind of the culture, the importance of culture, and young people's experiences. And you're talking about a population of young people who have experienced pregnancies that might have been unintended, and young motherhood. Is there any insights about kind of how this experience might vary across the sites, or is that in your plans for the future to look at?
Yeah, so we did see some variations, but not very major variations. I think across all the three sites, the experiences, especially of the pregnant and recently parenting, were very similar. However, I would place this also to the context because most of the adolescents that we interviewed, for example, in Nairobi, were coming from urban poor settings, so the urban informal settlements. Those we interviewed in Kisumu as well were from urban informal settlements, and then those in Kilifi were from very rural, marginalized context. So these are adolescents and young people who even prior to the pandemic were already living in very like harsh economic situations. And this can therefore like tell that most of these experiences then were very similar and not very different. Yes, there might have been some differentiations. I think especially when it came to access of health services, because we saw those most affected might have come from Nairobi. And this was just based on the qualitative nuances, like a lot of them in Nairobi, which was understandable because I think the lockdowns, that is where they were most stringent within the urban city settings. Yeah.
Thank you, Eva. So I have a question for Kristin. Did you learn about community services that might have been available for young people or their families? What were they? How were they used?
Yes, we did. And that was primarily, again, related to both when they talked about stressors and the coping strategies. So with this notion of food, for example, in Blantyre and Kinshasa, there were instances of adolescents knowing that a certain food program. So they mentioned that there was a program for rice and that they, to cope with their fear of food, they would go to this place to collect rice for their families. So again, it seemed like it was more of a grassroots kind of organization to cope with this food shortage, but that was an instance, predominantly related to these basic needs in terms of community programs. I would say less so was noticed in the other sites. Again, it probably has to do with the lockdown and the timing of the focus groups as well, because in some of these sites, people were talking about, or adolescents were talking about, they can't even get out. And so it was hard to do some kind of community event with that. So it really, again, and their awareness of these also was a factor, especially early on when people were trying to figure out what to do.
Thank you. We have a question for Eva again. Did we see any early or forced child marriage and signs of gender-based violence or abuse?
Yes, so for this particular analysis, not, but for the broader study that was conducted by Population Council, yes, we did see some, even though low levels of early child marriage and girls alluding to the fear of parents marrying them off, especially in some of the rural context. We also did see some signs or some nuances from the adolescents, particularly in terms of like violence, especially because of like prolonged stay with their partners. I think we did publish another paper looking at like the quality of relationships they had during the pandemic, and we actually did see some nuances around like GBV within partners.
Thank you, Eva. And I think we're coming on time, so let me thank all of our panelists for sharing the findings of their studies. Thank you for joining today, and have a lovely day. Also, to end, you can find all of these results that are published in a special supplement of the Journal of Adolescent Study that was, I believe, published either in November or December of 2024.